Hey guys, thanks for popping in and joining us today. Putting a video together today to talk about why we breathe during CPR cycles. Why do we give breath? One of the questions that we commonly get is the assumption that that's no longer something we do, when in fact technically it is, but it is optional, right? So it is not required for CPR cycles to give breath to someone. However, it is highly recommended, right? So traditional regular CPR cycles, we give 30 chest compressions, we give 2 rescue breaths. Typically, this will be mouth to mouth in a lay person setting. It could be a ventilator or a respirator if you're in a hospital setting. So it really depends on your environment. But when we teach these to our base level, standard first aid CPR AED courses, pocket masks or face shields can be used, some kind of PPE to protect yourself as a one-way breathing device, breathing valve to supply oxygen, right? So when someone's unresponsive and not breathing or experiencing a respiratory failure or a respiratory arrest and they're not breathing, we need to provide them oxygen because they're not able to get it on their own, right? So that's why we actually give those breath. The question then becomes like, well, is that even effective? It's carbon dioxide, right? So with that said, when we give a breath, we give about 16 to 17% oxygen, which is helpful to provide oxygen to the lungs and then continue CPR cycles with those compressions. So again, it is a recommendation to do that. It is in a CPR course, we should be doing them because it is a standard for all these courses to actually practice that skill. In real settings and real situations though, it is recommended, it is not required in order to provide care immediately to someone who's experiencing a cardiac or respiratory arrest, right? So hopefully you guys enjoyed today's video, learning a little bit more about why we actually give those breaths to begin with and what they do. Feel free to reach out if you have any questions. Thanks.